Hello and welcome to the fourth edition of the Economic Times Healthcare Leaders Summit 2024. I'm Apurva Shukla and right now I have been joined by Vishal Bali, who is the Executive Chairman from Asia Holdings. Hi, sir.
Hi, Pura.
First question I would like to ask you is how's your overall experience at the summit?
The ET Summit is always the go to summit for the healthcare ecosystem in the country. And it's good to see the level of participation that's always here and the very specific points of conversation for the industry. So, congratulations once again for organizing an excellent summit.
Another question to you is what, according to you, are the current challenges that the healthcare ecosystem of India is facing,
Yeah.
and what kind of measures we can take to resolve them?
Yeah, so I think India's biggest challenge, of course, is the demand supply gap of healthcare. That demand supply gap is across the entire healthcare ecosystem in terms of hospital beds, in terms of physicians, nurses. So we need very innovative solutions. We need new models of healthcare. We need to show interface of digital technologies with healthcare to sort of create access, and particularly with 900 million people in this country having access to the internet, we can ride healthcare services on the back of that infrastructure. But more importantly, I think we have to address the accessibility issue. Uh, the PMJY scheme that we have is currently focused on only 40% of the population of this country, and which is at the bottom end. At the top end is private healthcare, and they will look after. But I think it's the big middle that needs solutions. And so, therefore, I think to create accessibility and affordability for the citizens of India around healthcare, there has to be higher spending by the government. Now, we all know that yes, healthcare is a state and a central subject, but a cumulative spend of just about a percentage of our GDP on healthcare is not going to take us to the universal healthcare coverage that we aspire to achieve in this country. If you take a look at the entire UHC implementations around the world, the average is about 68 on 100. Japan is at 83 on 100. India is 47 on 100. And countries like Bangladesh are actually at 54 on 100. So effectively, there are countries which have taken a big leap in terms of providing universal health coverage. And we need to incorporate some of those lessons so that India can create better access to healthcare for its citizens.
In support to this question that I've just asked you, I want to know what do you think? Do we need the change in the policy, change in the healthcare policies currently? What do you think about it?
I think India needs to first put healthcare as a priority sector. If we provide priority sector to infrastructure, and we don't really put that priority for the healthcare sector, it has to be seen at the same level as we look at infrastructure. Fundamentally, because healthcare, once it is given that central priority by the government at the center and the states, we will have long term solutions. Most of our insurance, public insurance ecosystems are not funded for the long haul. And that is the reason why there is a constant gap in terms of affordability. And while these schemes are reaching out to people, but the providers are constantly not getting their credits for the work that they do with these insurance schemes. So I think there is a lot of gap that we need to really create, which is and fulfill, and which is to make our healthcare schemes more efficient and more long term in terms of their sustainability.
Thank you so much for the amazing insights, Mr. Bali. Stay tuned to ET Health World social media platforms to know more about what's happening right here at this event.